Good morning, guys, and welcome back to it. Your Wednesday edition of the Now Morning Show continues as, let me correct myself, we are not just yet in flu season, but we are preparing for it. So we are talking this morning on the importance of the influenza shot. To have that conversation, we are joined by the Manager of Medical Research and Audit Directorate for Women's Health in the Ministry of Health, Dr. Ruma Brijal Nagasar, as well as Ms. Grace Sukchan, the Manager of the Expanded Program on Immunization for the Ministry of Health this morning. So ladies, good morning and welcome.
Good morning.
Thank you. Good morning.
Good morning, Trinidad and Tobago.
Thank you for making the time, because we know that this time of year, I can speak from experience, the flu and the flu-like symptoms are going around. And so first off, let's make the distinction, because the flu is not influenza. What is influenza and what is the difference between the two? Can we start with you, doctor?
Sure. So the influenza and the common cold, they have similar symptoms, but they are different. The influenza is caused by the influenza virus, and it can lead to more severe disease and hospitalization and even death.
Now, in terms of the symptoms that we're talking about, more severe, yes, the runny nose, yes, the cough. What else should we be looking for?
Right. So, yes, the symptoms include, as you indicated, cough, runny nose, but also fever, sore throat, joint pain, muscle pain, achiness, as well as diarrhea and vomiting. And some persons may have these symptoms without fever.
So if it is that you are experiencing these symptoms now, is it too late to get the shot?
At this time, if you have the, I'll leave that for Ms. Sukchan.
So it is advisable, if you are experiencing these symptoms, to delay having the vaccines.
All right, then let's get into that spread of the influenza shot. Because remember, influenza virus. We are probably going to wait till we're actually sick and seeing all of those symptoms. And we will probably still try to function normally, go to school, try to manage ourselves all together. How exactly is the influenza virus spread?
So the influenza virus is spread similar to the common cold. And you can get it from persons coughing and sneezing, touching contaminated surfaces. That's basically how the virus is spread. And it's one of the reasons that we ask persons to ensure that you practice proper hygiene, meaning wash your hand frequently with soap and water, cough and sneeze in a tissue and dispose of it, or even in your elbows, to prevent spreading the virus. We also advise in person, if you're seriously ill, seek medical attention, but stay at home.
So I may have done some things wrong from the jump, but in the case of then having those symptoms, as you rightfully say, it may not be the right time to get the vaccine. Let's talk about that. When is the right time? Who should be prioritized for the vaccine? And we know it's free, we know it's island-wide, but in terms of what it actually will do to you, let's get into the specifics.
Right. So for the influenza vaccine, the general public is recommended for all, but you indicated that there are certain persons who are at higher risk of developing more severe disease. So the high-risk groups include pregnant women, children from the age of 6 to 5 years, persons over the age of 65, those with non-communicable diseases, those with chronic respiratory illnesses such as asthma, those persons who have a weakened immune system or immunodeficient, such as those with tuberculosis, sickle cell disease, acquired immunodeficiency syndrome, those persons who are in the special forces, and healthcare workers.
Right, because you're more exposed than most. And so, granted that we have these people that we should prioritize ideally, when we talk about getting the shot, I noticed you mentioned pregnant women in that group. It would imply that the vaccine itself is very safe, yes?
That is correct. The vaccine is safe for pregnant women. And we do advise persons, and you asked earlier, when is the right time to get the vaccine? It is available now, and now is the right time. The vaccine arrived early, and therefore we are pushing the vaccine out to get people vaccinated. As we said earlier, the season starts from October to May, but it takes about 2 weeks for your system to be primed after getting the vaccine to develop antibodies to prevent the infection. So therefore, you should not wait until you start experiencing symptoms, but you should get the vaccine as soon as possible to prevent the influenza virus.
And
Go ahead.
I just wanted to say it is available at our local health centers Monday to Friday, and the vaccination schedule, it's available on our Ministry of Health website. We also have mass vaccination sites, and the mass vaccination sites will begin from Saturday, 21st of September, that's this Saturday, and will run for the next 2 weeks until October 5th. And it's available every day at those mass vaccination sites, which include Gulf City Mall, the Wali Nagar, the Arima District Health Facility, and the Saragandi Enhanced Health Center, and it's open from 12 p.m. to 6 p.m. every day from Saturday, this coming Saturday, for the next 2 weeks.
Okay.
It's also available at the antenatal clinics at the hospitals for pregnant women, as well as in the antenatal clinic at the health centers.
Okay, so what you've described there is for those persons who can't make it during the week to the health centers to go to the mass vaccination sites. When we talk about the antenatal centers, do you need to be a mother or a pregnant woman to access it altogether?
It would be for the pregnant women attending the antenatal clinic.
Okay. So that a random person who didn't make these other locations wouldn't go to that one for the shot.
Right, but they will go to the health center. Yeah.
Making sure I get it right. Now, going back to the actual 2-week period that you mentioned that we need for our bodies to assimilate, I guess, to the vaccine. Describe to me a little bit, Mr. John, what actually happens to us when we receive that vaccine?
So most persons don't experience anything. For other persons, they may complain, and it's normal for any vaccines that you might get a little sensitivity, a little redness, maybe slight swelling or warmth at the vaccination site.
Okay.
There have been some persons who said they feel a little sore throat, maybe, but that usually is mild and goes away within a day or two.
Okay. So in terms of the process itself, that 2 weeks that you talked about for our bodies to really be able to fight this, relatively normal, aside from
any
those small
vaccines,
things.
Once you get a vaccine, it does not work immediately the day after. It takes about 10 to 14 days for the vaccines to actually start to develop antibodies, your body to develop antibodies to fight the viruses. And this is why we have sometimes you might hear people saying, but I got the flu shot and right away I got ill. It could have been that you were already exposed to the common cold or to the influenza virus. And it is not necessarily caused by the vaccine, but because you were already exposed to the virus.
So from a personal perspective, as someone who is experiencing some of those flu-like symptoms, even the shortness of breath, because I thought I was on the recovery side of things, but I realized it slowed me down significantly. You mentioned earlier that the time to get the vaccine is not when you are already sick. Not wait till flu season, but the time is now. Yeah. If, like me, you're already experiencing the symptoms, will that response to the vaccination be any different? Will I see that I feel more sick than, let's say, somebody who is in better health?
Right. So as I said, in some cases, person may experience after getting the vaccine a little sore throat, not 100% well. And if you're already unwell and you take the vaccines, then it could probably exacerbate your cold symptoms, or if you're already exposed to the influenza, exacerbate the symptoms a little bit.
Okay.
So it is advisable.
So realistically, you expect a little, but you'll be on the upswing sooner rather than later.
Yeah.
All right. And in terms of the actual vaccination, the question always comes up, so I will ask it, but she's mentioned already, if you do take the vaccine, you can still get the influenza. I imagine it will just be a less severe version. Is that correct?
Yes, so it does not, it's still risk of getting the influenza. However, the illness will be less severe and less hospitalization. Yeah, I also want to mention, as what Ms. Sukchan was saying earlier about the antibodies that are being produced when you take the influenza vaccine. So if you are pregnant and you take the influenza vaccine, you will be protecting not just yourself, but your unborn baby, because the antibodies that you produce in your body will be transferred to your unborn baby, to your baby. So when your baby is born, the baby would have the protective benefits of those antibodies. Because remember, the vaccination for babies only start from 6 months. Right. So you get the coverage.
You're taking care of your kids.
In 2 months.
So, ladies, what I'm hearing is basically we have a plan. Whether you go to the clinics and centers during the week, or the vaccination sites on the weekend, or the special clinics for mothers and pregnant women, we have a foolproof plan as to how to navigate the upcoming influenza season. You're saying that it's absolutely free, available just about everywhere. Can you tell me a little bit as to, in comparison to perhaps previous flu seasons, what we've seen, whether or not people are actively going, and if we're seeing in society, we're winning the battle?
In terms of vaccination?
I think coming off of the pandemic and vaccination talk, it's important to ask the question. People were outright deterring or not doing vaccination and protesting, but influenza is something that we can navigate better.
So this vaccine has been introduced in the country since 2009. So we do have persons who actually call before the season starts. For about a month or so, we've been having people asking us, listen, we want to get the vaccines before we travel. You know, where can we get the vaccines? So there are demand for the vaccines. Yes, we may have some vaccine hesitancy in certain persons, but generally our response to the vaccines is good. And as Dr. Burchell would have indicated, there are that high-risk group that we really focusing on. It's available for everyone, but it is really designed and really procured for that particular high-risk group who can develop the virus and get severely ill.
Gotcha. So I appreciate then that you've taken the time this morning to let us know where it's available, who we should be focusing on in terms of those at-risk groups, and of course where we can get more information so that we can better protect ourselves this influenza season. Thank you very much for joining us, ladies. And of course that gives us a good idea as to how we're going to be spending our next few days, making sure that we get that influenza shot that is available nationwide for free as flu season begins in October, but it's better to be prepared now. We'll be back after these messages here on the Now Morning Show. Stick around, guys.
Where you go when you